My name is Dr. Robert Glansman, Chief Medical Officer of Clean Nanomedicine. And on behalf of Clean, the investigators, and most importantly, the patients and their families, it is my great pleasure to present to you today. Rescue ALS has established safety and suggested efficacy of CNM-Au8 for the treatment of ALS. Rescue ALS was a phase 2 multicenter randomized, double-blind, parallel group placebo-controlled study examining the efficacy, safety, and pharmacokinetics and pharmacodynamics of CNM-Au8 in early sporadic ALS patients. ALS patients screened within 24 months of symptom onset or 12 months of diagnosis. CNM-Au8 is an aqueous suspension of highly faceted, clean-surfaced gold nanocrystals shown to enhance neuronal metabolic energy, reduce oxidative stress, and improve protein homeostasis. The objectives of this study were to determine the therapeutic effects of orally administered CNM-Au8 on neurophysiology endpoints using motor unit index as the primary endpoint, forced body capacity as a key secondary endpoint, and exploratory endpoints, including the proportion of patients experiencing a 6-point or greater decline in ALS-FRS over the course of the study, as well as disease progression as defined by King's Clinical Stage 4 or death, as well as quality of life endpoints. In the top left panel, as you can see, there was a non-significant directional benefit for CNM-Au8 in the study population. This was non-significance was really driven by the bulbar onset patients who do not contribute to the primary endpoint. They had about an 8% decline in their motor unit index score, and that was approximately 30% of the study population. As you can see, for the limb onset patients, CNM-Au8 had a statistically significant benefit at week 12 and a strong trend at week 36 with a p-value of less than 0.08. We also saw directional benefit in terms of the secondary endpoint, change in forced vital capacity from baseline to week 36 in the overall study population. But more importantly, I think what we saw in terms of hard clinical endpoint, when we look at the proportion of patients with an absolute decline in ALS-FRS of greater than or equal to 6 points, which is a strong predictor of mortality based on published literature, we can see a significant benefit for CNM-Au8 versus placebo with an absolute reduction in risk of over 50%. We also saw significant improvement in quality of life for CNM-Au8 versus placebo. And most importantly, we saw significant less risk of ALS progression as defined by reaching King's Clinical Stage 4 or death with CNM-Au8 versus placebo. This was really driven by the bulbar onset patients. So even though there was no evidence that we could show for Munichs in this population because they really didn't progress in terms of their motor unit index in their limbs, which is how Munichs is measured, we did see significant benefit for CNM-Au8 in reducing the risk of hard disease progression in this population. We also saw intriguing evidence for a benefit in survival with CNM-Au8 based on comparing the risk of survival in the study population compared to the risk as estimated by the NCAL's survival prediction model, which, as you know, is a validated model which predicts risk of survival. In summary, this phase 2 proof of concept study shows that there is proof of concept for efficacy of CNM-Au8 in ALS. And importantly, the safety, there were no drug-related SAEs, there were no drug-related discontinuations. And so far, CNM-Au8 has been shown to be quite well tolerated and with no significant safety issues.